Healthy Climate New Mexico is an affiliate of the Medical Society Consortium, and Dr. Patel's leadership has been she has done such an incredible job, and both as a human being, as an organizational leader, and of course your expertise around pediatrics and children's health. But truly, you're all in for a treat.
Oh, thank you. I appreciate that. And likewise, I learned so much from Shelley's leadership and the leadership of Ashley and Paul at Healthy Climate New Mexico. So, I mean, just this is an organizing feat to get 200 people in the middle of the week to come to an event like this. So kudos. All right. We'll get
We need it.
So, as Shelley mentioned, I have three roles, I would say. I'm also a mom. I'm a pediatric hospitalist for Stanford. I work for a small community hospital where I call myself the jack of all trades, a master of none. So I care for premature infants, newborns that will go to our FQHCs, the private practice pediatricians see their own patients in the hospital, and then children that are sick enough to be hospitalized. In addition, I lead this large network. It's called the Medical Society Consortium on Climate and Health. And we bring together 58 medical societies, 30 climate and health state groups, and we've trained over 50 physicians underrepresented in medicine. I saw Dr. Keisha Callens here, who's one of the luminaries in our network that work in communities to make health equity the center of what we do on climate action. I just want to talk briefly about what brought me into this work, and it ties to largely what I'm going to talk about in terms of the health impacts of climate change, heat, and wildfires as well, because the wildfires are getting worse because of extreme heat. As I mentioned, I'm a NICU hospitalist, and so we had terrible wildfires in the Bay Area in 2020, thick, billowing black smoke outside, so much smoke that our filtration systems couldn't keep up. And I walk into the hospital, into the NICU, and you can smell the smoke on the inside. That's how much smoke there was. Well, that day I was we got some air purifiers in. I felt like I could make things a little bit better. That same year, the pandemic broke out. And this is a picture of my two kids. The weekend we went into lockdown. They were fighting all weekend because they were trapped inside. And this was a brief moment where they were hugging. And so I took a picture to remind myself that they love each other and I love them. But during that time period, my daughter started kindergarten on Zoom, like many children. And I was working closely with two other climate advocates that were pediatricians, Aparna Bowl in Ohio and Elizabeth Pinsky in Massachusetts. All of us climate advocates, all of us also trying to think about how could we get schools reopened safely. And what we recognized in that process is that we had so poorly invested in our children's future. We were not prepared, whether it was a pandemic or whether it was climate change. So I started to, and so, I would go into the schools in my district. We don't have air conditioning systems or HVAC systems. And I would tell them to install a MERV 13 filter. And they would look at me like I was crazy. Like, we don't even have HVAC systems. I would tell them to open the window. They couldn't open the window. They were painted shut for security reasons. So even the very basic things that we needed to do for our children, we could not do to keep them safe. So recognizing that hopefully we would get to a point where we would get a handle of the pandemic, but that climate change would continue to be a threat, I turned my attention to thinking about how schools could prepare for climate change. At that time in 2020, 2021, the federal government had massive amounts of funds for schools to invest in HVAC systems that had a dual benefit. Those HVAC systems could clean the air of viral particles, ventilate the air so that it would dilute viral particles. But the other thing HVAC systems do, they clean the air of air pollution. They can condition the air as well if they're attached to an air conditioner to make sure that classrooms are cool. And so I spent a lot of time and energy to make sure that schools in California were aware of these resources. 2021 comes around, we finally get the whole district reopened. And then in August, I'm fielding a call from somebody from the Department of Public Health asking, because their plan had been just to open the windows, but we were dealing with wildfires. So they said, what's worse? Is it worse if the kids sit outside and breathe the wildfire smoke? Or is it worse for them to sit inside with their masks off and eat lunch and potentially pass COVID to each other? And I'm just thinking, like, we've failed. We've failed if we can't even do the most basic things to ensure that our children can have a safe learning environment. And I felt really alone and very overwhelmed by the problem. I'll come back to that towards the end of the presentation. I just want to do a little grounding. And I know most folks are from New Mexico, while we also have folks from the rest of the country. So I'm going to talk mostly about New Mexico here. But the issues in New Mexico when it comes to things like heat and air pollution are issues that are happening in many parts of the country. I would say the West and Southwest are facing issues with extreme heat and poor air pollution in particular that are an even greater challenge in some ways. And that's both because of how rapidly it's getting worse, in addition to the infrastructure investments that we need. But in New Mexico, and this is data from Climate Central, you'll see that New Mexico has gotten about 3.7 degrees Fahrenheit warmer, reflecting an overall trend. And what that also means in terms of fire risk is that as these days get hotter and drier, there is greater and greater risk of these types of fire weather days that can worsen air quality as well. This was some really great work that was done by the Center for Climate Integrity, and you can go state by state if you go to this database, and it will show you for your state in terms of investing in what schools need for air conditioning. And the threshold they used for this was a day when it was 80 degrees outside. 80 degrees, now consider how hot it would get inside of a classroom, but that was their threshold for determining whether a school needed air conditioning or not. And what they found for New Mexico is that for New Mexico to be able to just ensure the basics of a cool classroom where children could learn safely, about $170 million just to install the AC. And then districts on top of that would have to spend about $7 million per year. And this was a news article that just came out last year. And this was about Albuquerque's school district. 70% of the schools in Albuquerque don't have air conditioning, and it is turning into an increasing problem. I'll talk in a second about the particular heat impacts that we're seeing. I just wanted to raise a few pictures here. This picture up here on the top left, this is in Arizona, in Phoenix. He stepped out, and Phoenix is undergoing also more hot days and longer periods of hot days that Arizona has experienced in the past. Arizona is also a place that has a lot of concrete, particularly places like Phoenix. So when it gets hot, it holds on to that heat. So this man stepped outside on a very hot day, got dizzy, fell down, and sustained a 2nd to 3rd degree burn just by falling on the pavement. I have colleagues that work in Arizona who tell me that the burn units are filling up over the summer from just the burns that are happening from us living in these concrete jungles. This graphic here in the middle, as I mentioned, I'm a pediatric hospitalist. I work in Livermore, where it got to 116 degrees. This was 4 years ago now. As a community-based hospitalist, we work 24-hour shifts, and on the holiday weekend, you work too. And so I was essentially there the whole weekend, and moms that were in laboring rooms that were south-facing, so those rooms got so hot. You walked in and you felt like you were in a sauna. Several of those mothers got called as having cardioamnitis, but I actually wonder if it was because all those laboring suites were so hot that the women themselves heated up. Our NICU filled up. We had children coming in with respiratory distress, which are all things that happen during periods of prolonged heat. And then this is a picture here of, I understand that New Mexico also experienced back at the end of March, we were also a part of this heat wave. 40 million Americans were under heat advisory in March. And that should give us all pause. Of course, places like New Mexico, I grew up in Texas, we are used to extreme heat, but we are seeing it during times of the year where we're not acclimated, and we're seeing it for longer periods of time as well.
Yes.
And
Just in our Southwest, we went over 100 degrees in March.
wow. This was some reporting that came out. This was the heat dome that happened in the Pacific Northwest, and this is just what it's like when you're in the hospital providing care. Physicians race to provide fluids to patients who arrive breathless, dizzy, and drenched in sweat. Others were brought in on stretchers, their body temperature so high their central nervous systems had shut down. Those who could still speak told of stifling apartments and sun that made their skin sizzle. Some had tried to walk to counting cooling shelters only to collapse in the blistering heat. There's been a lot of study and work on what the human body can handle in terms of maximum temperatures. And we think roughly, there's a lot of debate on this in physiology science, but 115 degrees, minimal humidity, wearing light clothing, an otherwise healthy adult, and drinking water continuously. And let's think about how many of those things need to be true. And let's think about as well that for children, they may not have access to water. They may not be able to get to a place that's cool. And why is that important? Well, we only have one real mechanism in our bodies to be able to cool down, other than behavioral things that we can do, and that is sweating. So when the external temperature is hot, our bodies heat up, and a signal goes on inside our bodies to say, well, the blood is getting too warm, because we need to operate at a very narrow band of temperature. So we start to pump blood out to our skin, and that results in evaporative cooling. That's essentially like a big sprinkler system on our body. And then that cooled blood comes back centrally, and our body's like, okay, we're fine now. The blood has cooled down. But what happens when it's so hot outside that it's like a child being trapped in a hot car, but you're on a hot planet? Well, your body doesn't know what else to do. It's just going to keep pumping the blood to the periphery. When it does that, it means less blood to your brain, less blood to your organs. As there's less blood to your brain, you get confused, brain fog. You start to make poor decisions. And so you might need some water or need to get to a cooler place, but you really don't have the mental capacity to be making those good decisions anymore. If this goes on and on, it can result in end organ damage and potentially heat stroke and death. So I like to just provide that kind of explanation as to what happens when it gets really hot, because again, I grew up in Texas. I have a lot of friends and colleagues there who poo-poo it, like, oh, we're tough here in Texas. We're used to the extreme heat. But after a certain point, we're not built for it. We're not meant for it. And especially for children, what do we see in terms of children and the health outcomes for children? So birth outcomes, we have very good evidence at this point that prolonged exposure to extreme heat increases the risk of preterm birth and low birth weight. There's emerging evidence on stillbirth where the link is a little bit stronger in terms of air pollution than heat, but that's an emerging area as well. We see more emergency room visits, dehydration, and heat illness. I gave a talk to a community here on the peninsula, a mostly Spanish-speaking community. And after I finished giving my talk about heat illness, the father came up to me and said, oh my gosh, like a few years ago, we thought our 8-year-old was going to die. Like we were on this stretch of road. There was nowhere for us to get water. He started vomiting and I didn't know what was wrong. And so we called 911. We went to the hospital, but now I realize he had heat illness. He knew something was wrong. He didn't know the primary cause of it. And so this again is to say that even though we know something's off, it's really important to build that consciousness that this extreme heat is dangerous, especially for children that may not know what's happening or be able to ask for what they need. On hotter days, we see worsening air pollution, particularly ozone. During one heat wave, a father brought his child in because he was having an asthma attack, and he was like, well, this is so odd. Like his trigger are colds, and he doesn't have a cold. He doesn't have a runny nose. He doesn't have a fever. I don't understand what triggered it. And so I educated him in the emergency room, and I said, today the air quality is really poor because it's a hot day. And since your son has asthma and his airways can get inflamed easier, that air pollution is probably what triggered it. But again, the father didn't have that consciousness in terms of air pollution being a potential trigger. We see higher hospitalization rates during heat waves. Because I live in Northern California, we don't have the same amount of air conditioning that I had in a place like Houston. And so I have a lot of families that don't have access to air conditioning. I've taken care of a number of infants over the years. Either it was that the family didn't have access to air conditioning. I'm starting to see families trying to make their formula stretch. And so they're diluting the formula, which can be dangerous for an infant as well. And then I've had one case before where the family didn't get the education that they weren't supposed to be giving their infants less than 4 months of age water. And so the infant came in with electrolyte abnormalities as a result of that. It has now become a standard part of my practice because I work with families that are often getting food assistance, that are on Medicaid. From the spring months through the fall months, I ask them if they have access to air conditioning and if they can afford to pay their energy bill, because there's a higher risk of mortality for an infant born during a heat wave in that first week of life. And I have screened several families that did not have a safe place to be, could not afford their energy bill, and I got social work's help with that. And then finally, extreme heat is associated with poor school performance as well. And this one, it's not hard to understand. Let's think about each of us as grownups. Are we our best selves? Do we function the best when it's a very hot day? Now imagine being a 5 or a 6-year-old. You are stuck in a hot classroom. You're being asked to learn. You can't do the things that you need for your own comfort. We have tons of evidence on this, that on hot days and hot classrooms, children have poorer learning outcomes. And it's not hard to imagine why. Just a few additional things to raise here is that extreme heat results in thermal burns. And so that's a young child who went onto a playground in bare feet and ended up with burns on their feet, not recognizing how hot that surface has gotten. We have to be especially mindful of what's happening with athletes. There's been good work in places like North Carolina and Georgia in terms of more resources on acclimatization and having safety plans in place, because exertional heat stroke is the #1 preventable reason why athletes die in this country. And we can expect that that can get worse as days get hotter and hotter. I've mentioned poor learning outcomes. And then there's good evidence on the mental health issues and conflicts that we see between children on hotter days. And again, just reminding ourselves what we feel like on a hot day, and then putting that into a context of a child where their prefrontal cortex aren't yet mature. I'd say most adults, maybe our prefrontal cortex aren't always mature either, but this is one of the most cited papers, I would say, in terms of the evidence on heat and unequal birth outcomes. And I raise this point because when children are born either premature or low birth weight, those have health impacts for their life course. And so this is a potentially modifiable risk factor, and one that I know a lot of the folks in my OB group, for example, did not know or were not aware of. And so there's a lot of work to be done to ensure that we are ensuring healthy pregnancies for healthy children, for them to start off on the best foot that they can from the very beginning. How does this translate in terms of things that we can do either in our practice or from a public health perspective to keep children safe? So I do community talks on extreme heat. And so I very proudly created this graphic because I couldn't find any good ones in terms of how extreme heat shows up for infants in particular. You will see there are good resources out there in terms of how a heat illness shows up for people that are older. So these are things like, headache, flushed skin, red skin, lots of sweating. But for an infant, it's going to look different. And so for an infant, if the urine is very dark yellow, that can be concerning. If an infant isn't crying tears, that's very, very concerning, because that's kind of late stage in terms of their hydration, but that's a sign. An elevated body temperature or dry diapers are all concerning in terms of an infant not being well hydrated. So it's really important that you're ensuring that parents and providers know the signs of heat illness in young children. And let me emphasize as well for providers, my son went to a preschool where, again, I live in San Francisco. Heat is not usually a thing for us. And there was a day where it was in the upper 80s, which is not hot for other places, but is hot for us. And my son came home and just drank all this water. And I went the next day and asked them if they were filling up the water bottles for the kids. He was 2 and 3 years old at the time. And they said, no, they can come to us if they need more water. And I had to educate them to say, a 2-year-old may not be connected to the fact that they're getting dehydrated. It's important for you as a provider on a hot day like this to make sure that the children in your care are well hydrated. Empower parents or caretakers to talk to their school boards, to their coaches, to ensure that there are plans for heat safety and for the signs and symptoms of heat illness, that education is in place. I got reached out to by a 12-year-old Girl Scout a few months ago who it turned out that the impetus for this was when she was in fourth grade, the air conditioning in her school in Sacramento broke. And they all ate outside on a day where it was 110 plus degrees, and many of her classmates felt sick, got headaches. One of them was throwing up. And she learned after that they didn't know the signs of heat illness, and her teachers didn't either. So she came to me to ask for a letter of support to her school so that kids in her school could be educated on heat illness. She's a really fantastic advocate. She got her state congressman to introduce a bill to mandate that heat illness education. But it's sad to me that a child understood this, and that us as grown-ups and adults have not created that education for ourselves. And then ensure families have access to cooling. We are seeing more and more work in the space, although there's always more to be done, as energy is getting more and more expensive, and it can be hard for families necessarily to access those resources. The federal government right now is trying to axe LIHEAP in particular. But for now, just knowing what the cooling centers are in your area. There are other common places of cooling, things like public libraries or a mall or a community center. And then checking in with your families for their ability to afford their energy bills. They might have air conditioning, but they may not be able to afford it. And so whether that's LIHEAP, which is on a federal level, sometimes states or public utilities where you are might have forgiveness programs for energy bills. And in places like Arizona, they're not allowed to turn off your power in the middle of the summer because it's considered unsafe. And so the issue with that, though, is that bill then gets deferred to later. So it's not like families get forgiven having to pay it, which is another whole issue, but at least you can stop something dangerous happening in the moment. And we need more places to be passing laws like that. So I spent some time trying to find where I think the best guidance is right now. State to state, place to place, the guidance is going to look different. So the CDC does have a list of resources that are still active and up there that was last updated in 2024. I really like this resource better. It has a lot of the resources that the CDC has, but to me, it's better organized and better listed. So this is the California Department of Public Health, and they have resources for schools. They have resources for athletes on what heat education looks like, what acclimatization for athletes looks like, what water breaks look like. So I think this is a really great resource if you are looking for what you can do with your schools in particular to ensure that students are safe where you are. I want to return to where I started, which was talking about my work and how I got into this work on schools in particular and on children's health. So when I left the story, it was 2021. I had done all this work to try to get more HVAC systems into our schools and felt like we had made no progress. Well, at the time, it turned out that there were a number of other partners that were thinking about these same problems in terms of schools are the place where children spend the most time after their homes. And so it's a very logical place for us to be making investments in terms of climate resilience and making sure that kids have access to a safe and healthy education, but also that what we learned during the pandemic is what an essential role schools play in terms of access to food during the day, in terms of their ability to connect with their peers and have a place of community bonding. And so how do we look at investing in schools in a way that is worthy of our children? So I was very lucky at the time because there were several organizations that were thinking about this problem, but from very different points of view and very different expertise. And we all came together and we dreamed. We created this report for what climate resilient schools in the 21st century would look like. And we created a policy roadmap for it. So, and these are things like, we can expect that the grid is going to go out more often, see more black and brownouts as more people are accessing air conditioning because it's getting hotter. So can we install solar with battery at school so that they can keep the lights on and students can continue showing up there for learning and have a safe place to be on a hot day? When the air pollution is so overwhelming outside, we want to make sure that they're inside in a place that is both cool and safe for them to be. When the temperatures are hot outside, let's move away from those black asphalt playgrounds that result in thermal burns and kids having more fights because it's so hot outside, and move to nature-based solutions and green schoolyards where we have a ton of evidence that shows how good those green spaces are for their learning, their cognitive development, and their socio-emotional development with each other. And then when students struggle to make sense or find balance in the face of uncertainty, their schools can be places that offer connection, competence, and hope for the future. And so the policy roadmap really laid out a series of things that we wanted the state to take on. We introduced a piece of legislation twice. It passed our state houses twice. Governor Newsom vetoed it twice because it was asking for money and we were in a deficit year. And so we then took a step back, and the coalition that has taken this work on has been able to get a number of other pieces of legislation passed that take pieces of this, in addition to making sure that we had a big statewide school bond that passed, and we made sure that new infrastructure investments were green in nature. So we're taking pieces of it as we can to make sure that the principles that we laid out in this report are being implemented. And the coalition is quite vibrant. So we have a long ways to go, but we have a great community to get it done. This is my children's school in San Francisco. You can see it's a very traditional public school in an urban area, brick, black asphalt, locked in on both sides, not a lot of room to do the kinds of solutions that I'm talking about. But even here, there were parents, even before my children came there, who found a corner of the school lot and created a garden there. And these are my kids today. They're 11 and 8. And I don't know, for other folks that are parents or godparents or grandparents, I can't get my kid to tell me at the end of the day, like what their school day was like, other than when it's a garden day. And then they will not stop talking about it. It shouldn't take us this much evidence to know that greener spaces make us happier, make us calmer, are more inspirational for us. But I always look at climate solutions as not this big problem we need to solve. I look at it as a good an opportunity to build something better, reconnect us with nature, and reconnect us to the things that we know are good for our health and our happiness and our children's future. I'll end here. And if I don't know if there are any questions, Shelley, that you saw come up in the chat, I'm happy to answer any questions.
First of all, thank you so much. And there's so much there. And I heard a couple of people did have questions about schools, and, how do people get heat on the school board agenda, or how do, we really get heat education and conditions changed in our buildings?
Yeah. So it's really going to vary from place to place. And there is a group called, oh gosh, I'm going to have to remember it, but what they have specifically done is they go throughout the country and empower people to go to their school boards with specific ideas, because there is so much that you can do on the school board level. And one of the first places they start is to get a resolution passed through the school board to take the issue on. So you start there, because the resolution doesn't require a lot for the school board, right? To say, like, we care about climate change, we care about sustainability, and it opens the conversation to start taking more and more action. From there, I think it just takes some work to figure out, always, like, working with students that are there. The students have really great ideas, they have great energy, and they have great organizing potential. And so working with students and with teachers, because a lot of these things affect the teachers as well in terms of their health and their well-being. So forming those kinds of relationships, coming up with ideas that are rooted in what the community there is asking for, is a good place to begin.
Absolutely. And just to reinforce that, and we will show Dr. Patel's contact information. It'll be part of the agenda and the follow-up with slides and recording. But I've actually traveled to 40 of the New Mexico 89 school districts. We are very local, and you can give public comment at any of them. And Healthy Climate New Mexico is working with a number of organizations to start a school-based initiative. And we'll be obviously taking a good look at climate resilience California schools. This issue is an issue for staff and students. Of course, if we protect staff, we will be protecting students. So I really want to also, we'll be talking about our worker heat protection rule, but real
Oh,
opportunity.
yeah, let me
Yeah,
add one more thing there.
please.
The California teachers unions have been a huge ally for us in the state of California. And so that's another place to be thinking about who your allies and your friends are, is the teachers unions will likely be your allies on this.
Wonderful, wonderful.